One of the additional questions that we're often given is when somebody wakes up first thing in the morning, they're experiencing knee discomfort. Sometimes that discomfort can be pretty sharp, and they often experience it in behind the knee itself. And if they're engaging in certain athletics, sometimes that discomfort presents itself during those athletic activities. What are your thoughts on whether or not they should be doing some type of activity at that point, or what strategies could they employ to try to help them with that discomfort, Mike?
Well, chronic knee pain and that sharp pain that they get in the morning, in most cases I find, is coming from chondromalacia, where kind of the congruent surface in the back of the kneecap gets a little irregular, and some of that will come with age. But I think it's important in the limbering phase of the knee program is the fact that they're loosening things up and getting things going. It's almost a wheel alignment. When you look at the kneecap and the power and the forces that go into that kneecap, it's real important that the muscles and everything influencing that kneecap is really aligned and fired up and ready to go before you get into athletic events. I think a common thing that people find is, hey, when I sit on a plane for a period of time, I sit in a movie, they're sleeping, or they're in a chair for a period of time, in that bent position. A flexed knee is not a functional knee. And getting that out of that position and getting it moving, it's important to change things, get the tissues above and below the knee moving well, and really get that alignment and that dynamic component of a kneecap, which is so effective, kind of lined up where it's supposed to be before you get into any athletic events and really load that knee joint.
And for somebody experiencing discomfort first thing in the morning like that, do you think it would be of value for them to go through the limbering portion of the knee program?
Definitely. I think that limbering portion of elongating stuff and getting stuff going and really getting the blood flow of those old cranky knees, regardless of the age, I think is real important. And I think when people get into this program, the thing I think is going to really win a lot of people over is once they do it and they realize how good they feel, because that's a common denominator. Why do we do a lot of things that we do? It makes us feel better. And if we're doing this program, especially the limbering phase, when you first get up in the morning and you're feeling better, you're hooked. I think it's a no-brainer.
Absolutely. And the aspect of creating better muscle balance that somebody would go through and achieve by going through the FPR knee program really would help to take away some of that stress on the knee where it's being compressed into the knee joint, often causing grinding and irritating pains that they may experience first thing in the morning and while they're engaging in activities. So I think it's very important for people to go through and understand what you mentioned with regards to increasing blood flow to the area and creating better balance around those muscles so they're not getting the stress that's leading to their discomfort, and they are able to go through and create better balance and strength by engaging in the program.